Good morning, team. Thank you for giving me the opportunity to come and talk with you guys again. During our last meeting, we went over some of this information, but I decided to do a PowerPoint presentation and kind of put everything in perspective. So we're looking at the impact of speech and language delays on pre-literacy skills for our kindergarten students, and we know that articulation, which is the way we produce sounds, is really the key to helping them learn to read. So what are the speech and language areas of delay? Just wanted to give you an overview of what we look at as speech pathologists. We know that our team, our PLC, is really just going to look at the articulation because that's, we decided, was the most pressing need. But there are also language. We look at language in the areas of expressive, receptive, and pragmatic. We'll talk a little bit about that as well. We look at voice, the way sounds are produced and how we sound with our voice, and then the fluency of word production, not the reading fluency. I know we have a tendency to think about how rapidly we read, but not the case. So we said that articulation disorders are usually when the child has difficulty with the way sounds are formed, putting those sounds together to make words. Some of the suggestions or some of the examples are a student may say wabbit for rabbit, or they may say sip for ship, not able to actually make those sounds. One of the things I wanted to note, the articulation disorders constitute primarily most of the disorders we see. So 3 out of 5 speech and language disorders usually are the way students produce their sounds. So with that being said, what's the big deal when it comes to sounds? And when we're looking at our kindergarten students and we're expecting them to produce sounds, to identify sounds so that they can begin to read. So on the chart, we talked about this last week, and this is just a quick overview. We looked at the different sounds and the ages that they should be able to produce these sounds. What I didn't point out last year, at the top of the graph, it gives us the age. So we're looking at ages 2, 3, 4. We're going to stop at, well, 5, and then we're going to stop at 6 because most of our kindergartners are between 5 and 6. So all of these sounds, P, M, H, M, W, all of those sounds are sounds that we would expect the students to be able to produce. So when you're in the classroom and you're asking them to produce a sound or cat, what do you hear? What's the first sound you hear? They should be able to say K. K is a sound that generally is mastered by the age of 4. In terms of speech therapy, if they are unable to produce that a year beyond, when we look at that age coming in, might be a red flag that that's a student that you may want to refer to the speech therapist. So we reviewed this chart last week. Then a quick overview, expressive language is just the ability for the students to be able to express their basic needs, thoughts, wants. I need this, I want to go here. Those are the things we're looking at for expressive language. Receptive language is what they understand, following directions, sending them different places to do different things. They should be able to do that. And then pragmatic language is another area. We usually think of that in terms of social skills, interacting with their peers, that type of thing. So those are all areas as well that we look at. Voice, very quickly, we don't see a lot of students that have difficulty with voice. A medical doctor generally has to determine that they have difficulty with hoarseness, or they speak at a really high pitch, or they speak very, very low. We don't see a lot of that in the schools, but it is an area that we can address. And then again, fluency. Another word when you hear fluency is stuttering. Some kids have difficulty because they're learning to speak and learning to put their thoughts together, and they may not produce their words smoothly. So the speech therapist can determine if it's just normal acquisition of language or if they're really having difficulty saying words. All right, so let's talk about some other factors that can impact literacy skills or the pre-literacy skills. Of course, the speech impaired items that I mentioned, the articulation, all of those areas. Then we have students that have developmentally delayed needs. They're just not where their other peers are. Also, we look at English as a second language. Usually those students are learning English as a second language. So that sometimes affects how they learn and begin to read. So as we discussed, I'm going to skip ahead. I want to look at these numbers briefly again. We looked at this data last week, and it's really the data from 2016 and 2017. We selected 6 students that received speech therapy last year, as well as ESL services. Some of those students just had speech needs, articulation primarily. We had some of those students that had developmentally delayed needs where they weren't developmentally where they needed to be. And then we had students that received English as a second language. And so in looking at the data, I want to get some input from you guys. I know last week we noted some things. Can somebody share the trends? I know you may not be able to see this as well, but anybody note a trend in terms of where the students started at the beginning of the year and the growth that they made? Anything that we want to note? What's our expected growth for kindergartners?
1.5
Exactly.
years. Or
Yeah,
more.
at least a year and a half growth. And so on this chart, it's very small, but I will share with you most of the students made less than a year's growth. And so what we're targeting in this PLC is looking at the data, looking at the students that started the beginning of the year at RB, which is, you guys tell me, this is your
Reading behaviors.
Right, reading behaviors, and then PC,
Print concepts.
print concept. And they stayed there. So when we looked at them again at the middle of the year, they didn't go beyond the reading behaviors. And we know their goal for the end of the year was at least, what were we expecting by the end of the year? At least
Or level E.
level E. So as we can see with these numbers, looking at the data, we can determine which students we may need to do some targeted interventions. And that's why we came together today to kind of look at what we can do moving forward. So now I'll go back to the slide before. Best practice strategies, and I'll let you guys kind of help facilitate this. As we were talking earlier, we said effective lesson implementation would be a strategy that we can use. Kind of share what we can do for the effective lesson implementation.
When the children are grouped in small groups based on the data that we have already collected from the reading behaviors or TRC and the DIBBLs.
Right.
But their needs are addressed in small group instruction in addition to total group, whole group language.
Exactly. And what I like about that, and we'll just kind of put a little pin there because that was perfect. That would be a good place for me, as you guys are general educators, I'm a special educator. That would be a good place, as we said last week, for me to come into the classrooms when you have those small groups. That, as well as, I think, what did you mention? That I could look at M-Class. Can you share what you were saying would be easier for me to identify kids that I may need to see?
Well, I was saying before that if you will have access to our testing, like DIBBLs and everything else, you don't really have to talk to us ahead of time. You're going to see how many letters the child knows and how many sounds they can identify and how far they are with the reading testing. So you kind of have your rubrics already. So when you're going to show up for the small groups, you know which group is working on what, because when you're going to see the children working only with the letters and pictures that are related to it, obviously we're working on creating the sounds and the letter recognition.